Well, if you have bunions, well, you know how painful they can be. And sometimes you don't even want to stand up or put on shoes. But there's a series of bunionectomy trials here in San Antonio to evaluate new pain medications, and you might be able to be a part of it. We're out here at the medical center to learn more from Dr. Richard Pollack, founder and podiatrist with Endeavor Clinical Trials. Hello, doctor.
Hi, Fiona. Nice to see you again.
Of course. Thank you so much for having us here. So, a bunionectomy, explain the procedure and the steps taken to have one, or two if you need that.
Sure. A bunion is a common problem on the foot. It's of the big toe joint where the bone is quite prominent. It's hereditary in its nature, and we have done procedures on bunions anywhere from 12 years old to in the mid-80s. And so the problem with a bunion, particularly with women like yourself enjoy wearing nice shoes. And when they wear nice shoes, then that bone becomes quite prominent, and it's very uncomfortable and painful for a lady to wear a nice shoe comfortably. And so what we do in that procedure is we make an incision, generally either on the side or on the top of the big toe joint. We go through the tissue, we shave the bunion. We then make a cut in the bone, and we make that right behind the bunion. We slide that piece of bone, which is the head of the metatarsal, towards the second metatarsal, and then we put a screw in that bone to fixate it and then sew it up so the patient, after 6 weeks, can wear nice shoes again.
All right, so tell us more about the study. What are the additional benefits for the patient?
Well, the benefits to the patient, first and foremost, is they have a bunion, and the pharmaceutical companies will pay for the bunionectomy procedure. So even if a patient has a large deductible or actually has no insurance, they still can have a bunionectomy performed at no cost to the patient. And in fact, the pharmaceutical companies actually pay the patient to participate in the trial, and that's quite a benefit to the patient. So the patient has a bunion, they can have a competent surgeon perform that procedure, have it done for free, make a little money, and then be able to wear those beautiful shoes that you're currently wearing.
And so it sounds like a win-win.
It's definitely a win-win. And what I mean by a win-win is not only does the patient win because they had this procedure done at no cost and they were actually paid, the physician wins because he actually, Fiona, gets paid what he charges, which is pretty rare these days. Third, the pharmaceutical company wins because there's only been 3 new analgesic, new pain medications that have been approved since 2008. And last year, over 90,000 people have died because of overuse of drugs. And I'm talking specifically analgesic drugs. So if the pharmaceutical company can come up with some new innovative drugs that are not addictive and not narcotics, then the pharmaceutical company wins. And in fact, the whole community wins because we now have safer drugs that are just as effective as the current ones that we're presently using, but they're not going to be abused and people are not going to get addicted to it.
Dr. Richard Pollack, of course, founder and podiatrist with Endeavor Clinical Trials. Thank you so much for your time and all that information. For more on local bunionectomy trials, just visit removemybunion.com or give Endeavor Clinical Trials a call at 210-899-5778.